I arrived in Khayelitsha in April of this year. Khayelitsha is an informal settlement in the Cape Town area of South Africa. It's a population of approximately 750,000. The houses are invariably shacks, but there has been an activity in the near past to build new homes. But the infrastructure supporting the population is very inadequate. The majority of the toilets are outside of the houses. There's supposed to be one toilet for every 5 families, but at the moment that ratio is not being realized. Many of the houses do not have running water in their homes, so they have to go out to standpipes to get their water. The houses are very cramped together. The cleanliness in certain parts of the area is far from healthy. So these concerned me as how to overcome them, and became the major challenge. Public health issues. And then again, looking at the Department of Health, their clinics were overwhelmed because the burden of disease was enormous, but equally overwhelmed because they have shortages of staff. So the problems of health are reflected in the results. There's a high death rate in the area from accidents. HIV is the highest killer, TB, and then tragically amongst the children, it's diarrhea and diseases which are preventable like measles. One of my priorities was, having identified the problems and the challenges, was to motivate to the management of Ikamva Labantu solutions. And to me, the most important solution lay in changing the attitude of individuals living in the community to the health and the public health issues. And this meant informing them about what can be done, and at the same time drawing their attention to the fact that they have a right to health, and that right enables them to start to protest in a sensible way in order to get better services. So the first thing was working in Ikamva Labantu. We reassessed the road forward, and we identified that we should be focusing on health education, health promotion, and by health promotion we're looking at increasing the capacity of the community to voice their rights, increasing the infrastructure, looking at means of disseminating the problems that related to public health issues like water, sanitation. And then the third one was looking at preventative health, making sure that immunization took place, making sure that clean water is available, or if not available, at least people knew how to sterilize the water, and at the same time looking at areas of high incidence of death, road accidents, making sure that there's a sense of understanding amongst the taxi operators of taking care of pedestrian crossings and traffic lights. Then it was a case of building relationships with the Department of Health, finding out from the Department of Health what role they saw an organization like a non-profit could do to assist them. And we were given a number of interesting leads, which we are now following up, such as using the center as a recipient of pre-packaged medication for chronic ill patients, so they no longer have to go to the clinics. Another incidence is there are patients who are HIV infected but not yet eligible in terms of their CD4 count to go on antiretroviral treatment. They need to go somewhere where they could meet and share their sort of life problems with one another as a support group. So that is being looked at. And then of course there's the center itself that we have, that we will use it for a training center. And we are now looking at working with all the Ikamva Labantu beneficiaries. And that process has started, and in the time that's lapsed since we started in May in the training program, we've done 900 lectures to individuals. So we are feeling that at least the process has started in terms of finding the solutions. And the last thing that we've done is work with other NGOs. We don't want to be all things to all people, and we have a lot of NGOs in Khayelitsha. We have developed relationships with several of them. we've signed memorandums of agreement whereby we will be able to use their services to help the training process, and at the same time, if they need our training opportunities, we will make that available to them as well. So collectively, we are now having a system whereby we are providing a platform for taking these solutions that we've identified forward, and I'm quite sure that we will be able to make an impact in the community in the near future.